Hi, my name is Giovanni Bruno and I'm from IGSYS. We are at the south of Brazil in a city called Joinville. It's a very nice Saturday, 1st of June, and we are currently doing a series of actions towards the healthcare system. I'm going to explain to you guys a little bit about it. What happens is that in Brazil, just to give you a little bit of background, what we have here is a very huge problem with public health. In this city, I'm not even mentioning São Paulo, we have more than 7,000 people waiting for a single appointment or even for simple procedures. We developed a system that helps these people to get access to the physicians, to the procedures, to the laboratories, to all the attention, all the healthcare that they really need. And today, in this event, we are currently working towards the screening test published by the American Academy of Ophtalmology, which relates the ocular pressure amplitude with the carotid artery stenosis. So that's what we really are looking for, the integration between specialties, as I've mentioned, and this provides us means to go and, like, for instance, carotid artery stenosis is one of the biggest complications around here. A lot of people die from stroke or the cerebral accident, which happens to most of the people. This is the main cause of death in Brazil. With a simple tonometry or ocular pressure examination procedure, we can actually do a screening to see if these guys have more than 70% of blockage on the carotid artery. This is one of the main factors for the cerebral accident, the vascular cerebral accident. And this is exactly what we've been targeting in this event today. We're going to show you a little bit more in the images, and I'm going to interview a little bit with our partner, Dr. Ademar. Thank you so much. We're here now today with Dr. Ademar. He is a Brazilian physician specialized in ophthalmology, and we are here today, as we spoke before, in this poorly translated program as Health Generation, which is Programa Geração Saúde. This program actually is trying to perform a screening test to see if in this location, in our region, we can actually have the same accuracy and test results for the last study published in 2012 by the American Academy of Ophtalmology. And we are going to talk about this with Ademar. So, doctor, can you please just tell us how exactly works this ocular pressure amplitude? What exactly does it mean? What does it give to us related to the carotid stenosis, which is potentially what we've been studying here?
Sure. First of all, we have to understand that the intraocular pressure is the most important factor to the diagnosis of glaucoma, okay? But it's not the only situation we are trying to make a scanner here. The difference, the wave, the difference between the wave of the high and the low pressure at the same eye means that we have something of difference between the good and bad results. If you don't have a big wave that in this study you mentioned, yes, 0.3, it means that something is wrong with the carotids.
So in this statistical analysis study, it was actually published that if the difference is very low, we can actually have more than 70% of stenosis in the carotid artery. So that's quite of a problem. Asking again, so how does it work, the ocular pressure? Is it like the arterial pressure? Is it like the heart? How does it work?
Yeah, every time that your heart makes a beat, you have the high and the low pressure, the systolic and the diastolic. Yeah. The systolic is, we see in waves when we are measuring the intraocular pressure. The systolic is the high wave and diastolic is the low wave. This difference is very important. We don't have yet these studies here in Brazil, but we realized that people older than 60, maybe a bit more, old, yeah, years old, they have more this tendency of to have a low difference between the waves, the high and the low waves.
Great. So it's a bit like the heart pulse. So when you see the pulse, it actually gives a high and a low, like or estimated Dr. Adama was explaining to us. So we are going to send these studies towards the Academy, the American Academy, to see if in this region, again, as I was saying, we have the same sort of incidence here as it was. Firstly, it was studied in Zurich. So we are going to see if we match the same results. Dr. Adama, thank you so much for being here performing this. This is a very noble cause. It's a social action. We are a technology-based company that aim to achieve the integration between specialties, and Dr. Adama is a great partner. Thank you so much.